Tuberculosis is an old disease that remains a global problem, even though the World Health Organization reports the death rate has dropped to nearly half of what it was 20 years ago.
1/3 of the world's population is infected with tuberculosis latently. They're not sick, but they potentially could get sick because they have tuberculosis in them.
Dr. Anthony Fauci heads the Infectious Diseases Division at the U.S. National Institutes of Health. Most of those infected with TB live in developing countries, and people with HIV have the highest risk of developing TB.
Each year, there are over 8 million new infections with tuberculosis whereby people become ill.
1,300,000 people died from TB last year. The medical aid group, Doctors Without Borders, warns that drug-resistant TB has become a global threat. Tuberculosis is caused by bacteria.
It's spread by cough.
In Chicago, Dr. Dean Schroffnagel treats about 200 TB patients a year. He spoke via Skype.
And once treatment is started, the medication, the disease becomes non-contagious very rapidly.
So treatment and prevention are intertwined.
Treatment is prevention, because once you treat a single case, then that person is no longer able to spread it to anyone else.
The problem is the billions who don't know they have TB are not in treatment or stop taking their medicine. But despite this, there is good news.
Over the last 10 or so years, the number of cases and the number of deaths from tuberculosis has come down, mostly through public health measures.
Almost every country in the world is improving their infrastructure, how they deliver health care, how they treat patients with TB. A vaccine is on the horizon, although probably not for at least 5 years. And it has to be tested, so maybe even a little bit longer.
Tests can detect latent TB, and treatment can begin immediately. But what's needed are faster-acting drugs.
Whenever you have a disease that requires you taking multiple pills every day for several months, a lot of people drop out. They get drug fatigue. They don't want to be on a medication.
If there's a message for the world, Dr. Schroffnagel says it's this.
We can't let up. We can't say, okay, we've made some progress, we don't need to do more.
That's because it's clear that if TB is not controlled early and drug-resistant strains spread, the world will face a much deadlier threat. Carol Pearson, VOA News.